Now, in America, the big news in the pandemic this week was the country losing one weapon in its arsenal against the pandemic, at least temporarily. That Johnson & Johnson vaccine had to be put on pause. And to discuss that, we're going to bring in our friend and medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. Baskies, good morning.
Good morning, Stephanía.
So, here's what's behind all of this. The FDA requested that states temporarily halt using the J&J vaccine out of an abundance of caution because 6 women developed a blood clotting disorder. Now, we have to say those 6 cases were out of nearly 7 million. So what do you make out of that decision?
Well, Stephanía, this was a pause that was called for that was really heard around the world. Europe's canceled its contracts with J&J and with AstraZeneca. Right now, it remains somewhat questionable what's going to be with the J&J vaccine, unfortunately. The CDC Review Board needs a little more time to decide on what exactly the data shows. All of this is in response to a risk, as you said, that is still unproven and at worst, very, very slim. Look, there were 6 cases of clotting reported among 6.8 million shots that may not even be related to the shots. But even if the vaccine is linked to clotting, the incident rate is less of a risk than taking birth control pills. So put that into perspective. The bottom line, the risk of COVID, after all, still appears much greater than any risk from the J&J vaccine. I don't want to second guess the CDC, but they may well conclude that the vaccine is relatively safe and should be used with caution among women under the age of 50. We have to be a little bit more patient until the CDC review finishes its work, and then we'll know for sure what we need to do. One thing's for sure, however, we need all the vaccines we can get.
So, Dr. B, I have to mention this. You know, a lot of people that we've seen and heard from in our city they're skeptical about the vaccine. And so it's taken a lot to get them to the point where, you know, they feel comfortable taking a vaccine like the J&J vaccine. So this was a huge setback for them. What do you tell the people who had to overcome their anxiety to get the J&J vaccine and they're concerned? What do you tell them as a doctor?
Well, one thing you should know is that even though the vaccines are being given, they are being watched very closely, and any results or any side effects from those vaccines are being monitored. So it isn't as if we don't know what's going on. I hope that the pause with the J&J vaccine doesn't fuel the folks who are on the fence about getting vaccinated. We have now vaccinated 15% of the U.S. population. Things that lead to questions regarding safety and efficacy cannot help the cause to get back to normal with vaccination. People have to think, how can I make myself, my family members, my fellow citizens safe and healthy? The answer is simple. Take a shot. You have a choice. Get the vaccine or you will get this virus. So we have to be really, really cautious, but at the same time, there won't be anything that's going to be done without realizing that we have to vaccinate.
Dr. B, we have 1 minute left here. Do you think it's going to be harder now to reach herd immunity because of this pause?
I hope not, but I do think it is going to be difficult. What we're seeing right now is a decrease in the number of adults who want to get vaccinated. It's leveling off. So that's one of the things that I'm most concerned about. It is a slippery slope. We have to get to about 75 to 80% of the population either having had the COVID virus or having been vaccinated. So it is going to be a slippery slope, and it's going to be a moving target, unfortunately. Yeah.
All right, Dr. B, thank you for joining us and sharing your insights. And we're going to talk to you again in about an hour. And when we do, we want to talk to you about those reports of breakthrough cases, because that's something else we need to discuss. And we're going to see you right back here at around 10:15.
No problem.
All right. Thank you.
Thank you.